name is Courtney Autumn. I suffered with a mucinous borderline tumor. It's a tumor that affects my ovaries. I had 2 growing inside of me back in September of 2022.
How has the diagnosis of the tumor affected your daily life?
So it affected my daily life with reasons on I can't have kids. I can't have kids naturally. So that plays a big part in a female lifestyle, because every little girl dreams of having a family of their own, and I can't do that. I have to go and pay someone for me to have kids, and that's a lot. It's hard on a woman, and I have to watch my menstrual cycle, like key points every single month. I have to watch what I eat. I have to make sure I'm not gaining too much weight so quickly. Just having those effects where it's always a what if. Like if I gain 5 pounds within a month, that kind of always brings me to question, is it growing, is it coming back? Or with me having irregular menstrual, that always causes something too. So there's always that what if in the back of my mind.
So what circumstances led to the diagnosis of your meniscus tumor?
The circumstances, back in September of 2022, I woke up one morning and I was completely like yellow, like I got jaundice. Jaundice is when you have liver cirrhosis is what they call it with that. So I went to the ER back then, and I could barely like breathe on my own. I could barely lay on my back because it hurt so bad. I couldn't drive for a long period of times because my lower back would hurt and stuff like that.
So what treatment options were presented to you?
So how severe the tumor was, it was pretty big. Ian has the pictures of how big they were, and the only thing was to take it out. I had to undergo surgery and get it removed from my body, and it was scary because I didn't know if it was cancerous or if it was non-cancerous, which is benign. And that was always the scary part of it.
Did you encounter any complications regarding the treatment?
Yes, like I said, I had lower back pain. I couldn't sit for a long period of time. I couldn't lay on my stomach. I couldn't lay on my back because it would be trouble. Like I would have trouble breathing because the tumor of how severe it was just like pressing my organs up, like I was pregnant, but I wasn't. And that had a lot of side effects. I was constipated a lot. I had irregular menstrual periods. I lost a lot of weight, but in my general stomach region, it looked like I was pregnant. Like it was really hard and really stiff, and it just didn't feel like, fat. It felt something like it was wrong. But I never knew I had a tumor growing inside of me. I always just thought I was getting chubby, or I had bad eating habits and stuff like that. So that was always something that I never took into consideration with that. And I just had lower back pain. But like I said, I just thought I was gaining weight. And I just never thought I had a tumor growing inside of me.
With all your circumstances, how are you currently dealing with it?
It's hard some days. Like I said, it's always that what if in the back of your head. And I am from the Navajo reservation, so there's a term that they use. It's called yiya, like don't talk like that. Don't wish stuff upon you. But I live in like I don't want to be rude, but I live like in the white man generation where I think there's always a what if that comes into play. And with everything like modern medicine and stuff like that, that always tries to get the best of me. And with my grandmother being very traditional, she always just tells me like, yeah, don't wish that upon yourself, let it go into the past. Just continue to think positive about yourself and that everything is going to be okay. And there's always just two sides of it. And with me, I do struggle with that. I am constantly always thinking about it. Or some days I'm not, some days I am. And when I found out that I couldn't have kids naturally, that broke my heart. I've always wanted a big family. I've always wanted my own kids and see my kids run around and stuff like that. So now it hurts that it's a challenge for me when there's some people out there who can instantly have kids. And it hurts me sometimes to see someone pregnant because that could be me, but it's not. And it hurts sometimes. Sometimes I kind of just sit there and I think about, why me? Why did this happen to me? Why couldn't it be someone else? And I thought about that for the longest time, because it hurts. A girl never thinks that she's gonna grow something on her ovaries or her fallopian tubes and get those removed. And it hurt me for the longest time. It hurt me to be around little kids because I knew I couldn't have that. And sometimes I think about it, it still hurts. I don't know why I'm crying, I'm sorry. But I feel like that's something that I will suffer for a little bit. I continue to suffer with it. But I know, like I said, going back to my Navajo traditional ways, I know everything's gonna be okay. I know one day I'll have kids, and that's what I pray for. And I know I'll have a little baby growing inside me one day, because that's what I want. And I just have to leave it up to, the Lord. And we say Diindene in Navajo, that's what we believe in. And I'm going to continue just to believe in them every day and let them know. And they know, I'm hurting, but I just have to continue to be strong every single day.
If someone in your shoes, what advice would you give them with dealing with the tumor?
Get help as soon as possible. Even if you have like constipation or you start having lower back pain or you feel like your stomach getting a little hard or you are out of breath or winded, get checked. With me being a female, we get yearly the yearly woman check. Please go to your women's clinic, get that done every year. Do pap smears, do the ultrasounds that women's clinic provides. Take that very seriously because I didn't. I know you have to start when you're 21, so please start when you're young because you never know what's going to happen. You never know what something, I didn't know. The doctors told me that I could have had it ever since I was in high school, or I could have had it when I was in middle school. I never knew about it. So just get checked, do your yearly woman exams. If you have, constipation or irregular periods, get your hormones checked. That's always something that us women should really take serious. Your body's very sacred, and that's something that it's all preventable if you just continue to go to women's clinic. Yes.
So what information was given to you about the tumor when you were first diagnosed?
They just said that, like I said, it all goes back to women's clinic. It just maybe your genetics, if your mom or your grandmother suffers from cysts or it's basically what I had was just a big cyst, but it turned into a tumor with how big it is. So a lot of women, they deal with cysts on their ovaries. It is preventable. Like I said, go to women's clinic, you'll learn all about it. But they just told me that they get checked every 6 months, do blood work, and get x-rays. So that's what I continue to do, just to make sure everything's just remaining the same. You don't really know that until you get checked, so yeah.
What is a mucinous borderline tumor? A mucinous borderline tumor is a tumor that can be found anywhere in the body where epithelial tissue is present, but is most commonly found in the ovaries. This tumor shows abnormal cell growth but has a low potential for malignancy. It is called mucinous because it produces mucin, a mucus-like substance, and borderline because it falls between benign and cancerous tumors. Although infrequent, it does have potential to reoccur or spread. What are the known risk factors for a mucinous borderline tumor? As this commonly occurs within ovaries, the risk factors are primarily related to the genitourinary system, and factors that affect that system include smoking, women with infertility issues, history of pelvic inflammatory diseases, family with histories of these tumors, mainly in sisters, and use of fertility treatment medication. What are the treatment options? Primary treatment for a mucinous tumor is surgical removal of the tumor. Then, depending on the location and characteristics of the tumor, there may be chemotherapy, radiation, and/or hormone therapy. Treatment is specialized for each patient. What does a mucinous tumor affect and attack? These tumors primarily affect the linings of internal organs such as ovaries, colons, or appendix. The production of mucin can build up and cause complications by compressing surrounding tissues and organs. This can cause abnormal distension and disruption of these functions of these and surrounding organs. How is a mucinous borderline tumor different from other ovarian tumors? Mucinous tumors produce a large amount of mucin. Due to this mucin, these tumors appear as large multicystic masses on imaging and are most likely to be found at an early state due to their large size. This large size tends to cause symptoms earlier than other types of ovarian tumors that are not as large and appear more solid on imaging.